This is Rahul Gulve, Visceral Manipulations and Pain Therapies. So today we are with Mr. Uh, Manoj Garu, aged about 45 years. So he had an issue with his low back pain and medical person sciatica. So this is a testimonial video. So we'll be talking to him. So how are you, sir? How was your experience with Ashoka and how it was started?
Yeah, so first of all, it has been a great experience. I would like to thank you, sir, first of all, for treating and making sure that I'm getting back to my day-to-day activities now. So I feel there is a very big difference compared to how I started when I came initially with the pain and how I am today. So thank you so much, and thanks to the entire support staff as well.
Yes.
So talking about the journey, sir, my lower back pain started 2 years back. So once it
What do you do actually?
I am basically into IT work, so it was a sleeping work always. 2 years back, this problem started all of a sudden, and I've been going through the pain on and off. And I consulted different orthopedics. I went for Ayurvedic treatment. I went for some laser treatment as well for some years, but then there was no respite. Then I found out about Ashoka through Google. I was Googling, and that is how I found out. I went through the reviews, I went through the YouTube videos, testimonials, and then that is how I came here.
How was the pain that time?
Yeah, the pain was bad because I had to sit for most of the day, and I couldn't sit. If it is more than 5-10 minutes, I started to get the pain over here at my back, and it was very uncomfortable. So I was not able to concentrate on my work as well. So that is how I was managing. And then once I met you, then you told me about the exact nature of the problem and what is the treatment that needs to be prescribed for this. So that is how I started the treatment.
So intensity and what about the frequency? So when you sit, when you stand, when you walk, which one is causing more discomfort and now how long you can able
Sitting was causing more discomfort because if I used to sit for 10 minutes also,
to?
so then I had to get up, and it was very uncomfortable for me.
Okay.
So I was not able to sit for a long time, more than 10 minutes I will say. Standing, I could stand for like 10-15 minutes, but not more than that as well.
Okay.
So because of that, it was impacting my day-to-day activities as well. I used to play sports. I stopped playing sports because my body became very conscious. It was not allowing me to go for any sports kind of activities.
What about driving?
Driving was also bad because I used to drive for long hours. I used to go out of Hyderabad, right? So it was like 7-8 hours driving. But then that also used to cause a lot of discomfort. So I had to take breaks in between,
Okay.
and somehow I was just managing. I would say because.
And how was the nature of pain that time?
While driving, yes, it was bad because then my cervical was having an impact, and I could feel that heaviness here in my neck part. And plus, along with that, I had a problem with lumbar also. So I just had to adjust my seating.
Okay. What
While
about
I was
radiating
driving.
pain to your right leg?
No, the right leg pain was not radiating there down.
Mm.
Luckily, it was only till here, but then these two things were causing a lot of discomfort.
More discomfort.
Yeah. So the pain was not radiating towards me.
Okay. So you have consulted. You have taken medicines from the doctors and.
Yeah, so when I first showed this to the orthopedic just examined me, and he told that this is some kind of muscle pull and this will go off. So I did some physio sessions, but that was not helpful.
How many?
It was like for a week's time, or I think 10 days. So I visited two different orthopedics.
Okay.
So both of them told this is just a muscle pull, nothing to worry about it. They prescribed me some physio and they gave some painkillers to me, and I tried doing that, but that was just a temporary relief. Then again, after 10 days, the pain again started, and it was causing a lot of discomfort. Then I went for an Ayurvedic treatment, which was like a session for around 20-25 days.
Okay.
That was a therapy.
What they have done?
So there were different kind of therapies that they have. They have that kiri that they massage on the back oil, which they use. They massage that. So that I went through that entire. There were different sessions in that, but then still it was not giving me comfort. Maybe for the initial 10 days, once the treatment was done, I felt a bit comfortable. But after that, no. Again, it was the same. So then I had a laser therapy also for 7 days.
Where?
That was in Pune that I did.
Okay.
Yeah, so that was like not like a doctor or particular doctor, but a person used to do a laser treatment. So I went there. I
Okay.
got that also done, but then that was also temporary relief.
Mm.
And after that again there was pain.
So you landed here.
Yeah, finally,
Ultimately.
yeah. So I was destined to be here, and I googled a lot. There were some other pain management institutes also that I went through, but then when I went through the videos, when I went through the testimonials of people who actually got treated here at Ashoka, that gave me the confidence, because then I had actually lost hope, because this was actually bothering me a lot.
Your quality of life, your personal
Yeah,
life got
yeah,
disturbed.
yeah. It got impacted to a great extent.
Mm.
So that was not helping me, and that is how I came here. I met you. So the first day when we met, you examined and you told, without looking at it, you told that there is a problem with L4, L5, and you told me about cervical also, because the orthopedics, they never told me about cervical, the issue with cervical. They just told me about lumbar. That's it.
Mm.
Lumbar also, they just told, looking at the X-ray, that this is just a muscle pull, nothing to worry. Your body structure is fine. So you told me to get the MRI done. We got the MRI. In the MRI, it was mentioned that the problem is with L4, L5.
It is a L4, L5, L5 as well. That time you have a cervical pain now.
Yeah, I was having cervical. That had just started. I mean, like 2 to 3 months back, it had started. But earlier, when I used to drive, I used to have that problem. But this was continuous. It was going on, cervical, for the past 2
I
3
think we
months.
have treated for 7 sessions.
14. So we
14.
had 14 sessions for cervical and 28 for
21,
28.
28
28 for
for lumbar. Okay, so we are taking this video for 2 months. So this is, as we have already told, this is a testimonial video, and we have treated him in very frequent intervals. It is also regular treatment. And after the overall session, so how do you feel that your body, getting response in the from starting first few sessions to middle and last?
Yeah. So if I look at the first 1 to 4 or 5 sessions, the pain was severe, because the treatment has started, and plus the manipulation and all that also happened. So the pain was very high. I could
So
feel
I
the body.
think your neck got
Yeah,
restricted that time.
yeah, and I had that head spinning also.
What
Which
is
was,
also?
yeah.
Yes.
So it
In the
was
starting
bad.
days.
Yeah, it was bad initially, but then when I told you about the problem, you mentioned this is part of the treatment, and this will subside going forward. So it will improve going forward.
Yes.
So gradually it improved, and the pain has subsided. Though sometimes I used to get this muscle kind of pull in between. So yeah, stiffness basically. So after manipulation and the treatment, it used to get better. And plus, Lavanya ma'am has prescribed the exercises also, so that I have been doing regularly.
Yes.
So that helps me a lot. So now, if I have to look at how we started and how we are, I think 85% of the pain is gone, I would say.
Good.
85% of the pain is
So
gone.
how long you can able to sit now?
I can sit. So let it be 45 minutes, 1 hour. I can sit at a stretch. No issues on that.
What about driving?
Driving also. So I can drive 4, 5, 6 hours without any issues. So I don't feel that stiffness now. Occasionally it is there in between sometimes, but then when I do these stretching exercises and all, it is not.
Okay, how will you say that how much your quality of life got improved?
It has improved a lot. It has improved a lot. Though I have not started playing sports and all now, I would like to start with it. But then I do walking regularly, and when I play with my kids also.
How long you can able to walk? You said
I can
5 minutes or 10 minutes.
Yeah, I can walk.
What was it?
At a stretch, I can walk for more than 30, 35, 40 minutes.
Without pain, without
Yes,
this, no?
without any issues. And I can stand as well. So all these things have improved, and that has gradually improved my quality of life as well.
So overall, how do you feel that the progress before and after?
Tremendous progress. And I would definitely recommend people, those who are watching this or would be watching this going forward as well, I would definitely recommend them to come and get this diagnosed by you, get that treatment once, and I'm sure that you will definitely be glad and happy like how I am. Because when I came here, it was like I was just hoping that this gets cured. Uh, with that intention, I came here, because prior to that, it was becoming very difficult for me.
Yes. So See, people who are suffering with structural issues, whether there is a dysplasias or radiculopathy or nerve impingement or local pain. So when you think that after doing everything, we are not getting out of from the pain and we are getting still the same compromising quality of life. So definitely you can come here and you can put a full stop for your problem. And definitely the cases who we take as we can treat, majority of them they will be getting a beautiful result. How was your overall experience here?
So, talking about the
Because you
treatment,
have consulted many physicians before consulting us,
yeah,
and in the initial phases also your intensity of pain is so high.
yeah, correct.
So see, by committing these many patients, we have already treated 28 patients for his lumbar spine and 14 patients for his cervical spine. So majority of the people do not dare to take this much of long step
Correct.
because you have tried multiple therapies and invested much.
Yeah,
So it is a big deal to take a decision.
yeah, correct. So, this was important for me because at the end I wanted to make sure that I'm coming out of it, because from a long-term perspective I had to look so that these issues are not reoccurring again.
Yes.
Temporary treatment is not the
Solution for the
solution that I
problem.
feel. So I wanted to go for a long-term treatment, and that is how I started with the treatment here. And I felt the confidence right from day one when I visited you. When you diagnosed the issue, you straight away told me to take an MRI scan and come with that MRI scan. It's right. So after looking at it, you prescribed me the treatment, the schedule of the treatment, and when I started the treatment, it gave me the confidence. The pain was there, but then I was sure that under your guidance and your treatment, the pain will subside. You had mentioned that before also,
Yes.
that there would be variations in the graph,
Yes.
pain graph, but then subsequently it will subside at the end of the session.
Yes.
So that is how it
That
has
is
been.
what it has happened.
That is what has happened. So, so thank you so much, doctor. And I would definitely recommend Ashoka, pain management for everyone who is watching this. At least give a try once. I'm sure that the quality of life will definitely.
I know. See, one more success story added, and people who wants to try, please don't come here. So if you tried everything and you are fed up with everything, come here, we'll cure you. This is the ultimate slogan for us. And people who really wants to get cured, this is the place because we are treating the source of the problem, not the symptoms. Of course, to treat the source of the problem, it will take time. You should have a lot of patience. You should have a lot of commitment to overcome out of the problem. When you are ready to that, please do come. We'll work together and definitely will improve your quality of life. Thank you. One more story added.
Thank you. Thank you so much. And a special thanks to Lavanya madam, Ashok sir, Saraswati madam, all the support staff. There are some new staff also who have come in. I don't remember their names, but big thank you to everyone, because the kind of support that everyone has provided here, I think that is the major key.
Yes.
Because when we go home, the next day we feel like, yeah, we have to again come back for the treatment. It's not like, no, I don't want to go back again. No, that's not the
Yes.
case. So very supportive stuff, and everybody works together as a team, which is really really good.
Thank you.
Yeah.